Tell us about how the hair transplant works.
Hair transplant procedure, as I was discussing earlier, basically the whole premise is taking hair from areas of the scalp that are not susceptible to hair loss and transplant, which is what we refer to as the donor area or donor hair.
And you mentioned donor hair needs to be always from you.
Always from you.
Okay.
I'm sorry, yeah, always from you. That hair is then moved or transplanted from, let's say, the back of the scalp to the front to create more density of hair in the front. It's a very meticulous procedure. Obviously, the hairs are, whether you elect to have it through the FUG procedure or this, what we refer to as the strip or the incision procedure, or the FUE procedure, which is where hairs are individually extracted. Those hairs are then taken and analyzed under a microscope to ensure good quality of the hair grafts themselves. And then those hairs are then individually transplanted to the recipient area or the front of the scalp or the crown. Hair grows in groupings. So actually, you know, if you actually look at your scalp under a microscope or even with close proximity, you'll notice that hair will either grow in individual strands or in small groupings. Either 2 or 3 hairs will actually grow out together from the same follicle or follicular unit, what we refer to as. And that's important that we analyze that under the microscope. We separate those grafts because it's important for a very natural looking outcome, because you don't want to place the bigger hair grafts or the, let's say, the 3 hair graft groupings towards, let's say, the front.
Right.
Because that gives you an unnatural looking hairline. So the process actually entails specific pinpoint sub-millimeter incisions that we make in the front or the recipient area to be able to ensure that the hair follicles are placed in a specific area.